as the State Disaster Medical Advisory Committee um, did their deliberations, they looked at a number of different factors. One was the risk of disease and really the risk of death that certain population groups faced. And that certainly is why people over age 65 were included in the recommendations. 87% of the deaths in our state have been in people over age 65. And so that risk of mortality was very high in their deliberations. But then they also considered risk of exposure and what groups also posed risk of exposure and risk of spreading to other people. And so it was a balancing of those criteria that led them to, well, the first groups, healthcare workers, and these additional groups like educators, food chain workers, transit workers, utility workers, all public-facing professions that were prioritized because of the risk of exposure and where they stood in transmission networks that they could, I mean, disease transmission, not electrical transmission, that could spread to others. And so certainly people who are age 64 and under with chronic conditions are another group at risk. And that is a group that is certainly under consideration for a subsequent phase. And we're not changing this phase at this point in time, but I do think vaccine supply will certainly influence when we may be able to open up the next phase. And hopefully with increased vaccine supply, we'll be looking at that next phase even sooner than we might have anticipated a few weeks ago.